Welcome, everyone. I'm Lynn Ananye, school nurse here at Friends School of Baltimore. It's my pleasure to welcome our medical advisory group today to give us some information about the COVID vaccines for children 5 to 11. Joining us today on the Zoom are Dr. Mary Jo Minton and Dr. Jason Goldstein. Both are pediatricians. Dr. Christopher Hoffman and Dr. Stephen Ganji, who are epidemiologists and infectious disease specialists at Hopkins. Dr. Paul Sabandayo, a primary care physician at Mercy Hospital. Let's begin with some of our questions. Could you please tell us why you're endorsing COVID vaccination for children ages 5 to 11? Dr. Minton, let's start with you.
Well, this is a very exciting day. As most people know, the Pfizer data went to the FDA committee last week and was reviewed, and they supported emergency authorization use and forwarded all those recommendations and data to the advisory committee on infectious immunization practice. The ACIP committee, a part of the CDC, reviewed it yesterday, and there was they unanimously voted to give the EAU, the emergency authorization use, for the 5 to 11-year-olds. So the vaccine is out. And we're really excited. Our office got it this morning, and we are ready to roll. And I, as a pediatrician, am super excited. I think I'm really endorsing it because it works. It's well over 90% effective. It's safe. There are very few side effects, if none, no serious side effects for sure, in the trial. We've been giving it to many kids older and have had great success with that. And we think it's for a good reason. We think the risks of COVID disease far outweigh the risk of the vaccine. We know that in the 5 to 11-year-old population that there has been over 8,000 children hospitalized. At least 94 kids have died. Of the hospitalizations, a third of those have required ICU admissions, and a quarter of them have the MIS-C, which is the multi-system inflammatory syndrome that we see in children. And that is the age group that with the highest incidence of that very severe complication. We also know that about 10% of the many children who have had COVID have lingering symptoms. So we don't really know how long those will last. We're hopeful and optimistic those kids will get better, but there are still some long COVID cases in kids. And with the Delta variant having increased children's getting it, we know there are going to be more and more kids. And we really want to use this vaccine to stop kids from getting sick, to stop kids from spreading it to other vulnerable people, non-vaccinated younger siblings, older grandparents, etc. We want to get those kids back to some sort of normalcy. It's been very stressful for them. Families have had a lot of pressure to protect them, and it'd be really nice to minimize quarantine, to get kids back into activities and to feel safe for them. So I'm just super excited.
Thank you. Dr. Goldstein, anything to add? And you're on mute.
Thank you. I think Mary Jo said it perfectly. One of the things that I hear constantly about the vaccine and some of the hesitation is that, well, kids don't get as sick as adults, so why would we give it to them? And the reality, as Mary Jo so eloquently put it, is that it's a vaccine for kids to protect them, and there's real risk that they actually do get sick. Some kids have died, and long COVID is a problem. I saw a kid today who's having symptoms of long COVID, who has shortness of breath at all times, and so it's a kind of illness that we don't understand well enough to say don't worry. And I think vaccinating kids is going to continue to help us protect the population at large from getting sick and putting vulnerable people at risk. So I couldn't be more excited, and we're ready.
Great. How does the vaccination for this age group differ from the 12 and older vaccine? Dr. Hoffman, could you help us with this question?
Sure. I mean, in principle, it's the same vaccine, the same product. It's a lower dose. It's a third the dose, and that is mostly because the immune system of 5 to 11-year-olds is a little different than older individuals. So many vaccines have a different dose or different formulation for younger individuals, and but in terms of the immune response, it is similar to the immune response of the higher dose for 12 to 25-year-olds. And the effectiveness is also appears to be similar with in the initial clinical trials, which have really focused on safety. There's also been a reduction of about 90% on interim analysis of symptomatic COVID among children, with something like 17 in the placebo arm and about 2 in the standard of care, in the vaccine arm. I would also like to say, just in terms of side effects, which I think is certainly the big concern and the major concern of the FDA and CDC for evaluating this, and as both Jason and Mary Jo said, that the risk of COVID is, and the potential side effects of COVID or symptoms of COVID are more common than those of vaccination and more severe. And in the 1,500 individuals who received the vaccine between the age of 5 to 11 compared to the 900 or so got the placebo, really the only side effect that was higher in the vaccine is, I believe, more redness at the injection site. But fatigue, fevers, etc., were actually fairly similar between the arms. And but certainly after any vaccine, a child can feel some symptoms, and the average time in both arms, I believe, was around 2 days after the vaccine for symptoms. But appears to be effective and also very well tolerated. Just to touch on the last thing, comparing this to the age group of 5 to 11 to 12 to 25. A big concern has been inflammation of the heart, or myocarditis, which is really something that occurs most commonly among teenage boys from vaccination rather than the younger age group. There were no cases of that in the clinical trial. And overall, the risk of getting that from COVID is probably higher, as Mary Jo said. Some of the strong inflammatory responses from getting COVID include the heart, and more kids certainly have been hospitalized in an intensive care unit with a myocarditis from COVID than from vaccination in the 12 to 25 age group.
I see. Thank you. Dr. Goldstein, just as a follow-up, should families anticipate their child needing to stay home from school for a day or two? You're on mute.
Thank you, Lynn. When I do it again next time, keep reminding me.
Okay.
So I would not anticipate them having to stay home. I think, like any vaccine kids get, there's injection site soreness, and with this vaccine in particular, you can see mild cold-like symptoms and flu-like symptoms, but it's pretty unusual in my experience. Kids have tolerated the vaccine, at least at the older age group, the adolescent kids that we've seen get it, very well. And so I would consider it essentially like getting the flu vaccine. They send their kids to school the following day. I wouldn't anticipate there being a significant difference in kids' experience with this vaccine.
Thank you. Dr. Hoffman was describing some inflammation of the heart. Dr. Minton, any other possible long-term side effects that we know about at this point?
I mean, That is always the biggest concern that parents ask. One of the concerns that parents ask me about is long-term side effects. And I am comforted by the American Academy of Pediatrics and the intense work they have done to look at that. And they really feel like there's no reason that this vaccine, compared to other vaccine, is any more likely to have any more long-term side effects, that it's safe. And again, I think we all go back to the fact that we know for sure that the COVID disease itself can have long-term side effects in a much higher proportion than any possible potential long-term side effects from the vaccine. So this would not be a reason I would want people to be worried about the vaccine at all.
Thank you.
I'm going to add one thing to that, Lynn, that and give an example where I have a family that I follow where a kid had a blood clot, a very unusual thing as a young child, as an 8-year-old. And his hematologist at Hopkins, when they questioned whether they should get the vaccine and whether there's the risk of clotting or concern about it as it relates to this particular child with his unusual presentation, the hematologist felt strongly that the risk of getting a clot from COVID was upwards of 8 times higher than it was from any vaccine complication. And they said, without hesitation, get it as soon as you can.
Thanks for that example. When can families feel like their children are able to begin unmasking and being a little more social? After 1 dose, after 2 doses, 2 weeks after the second dose? And if Dr. Sabandayo could help out with this question.
Yeah, sure. So, just like our older folks, older patients, one is considered fully vaccinated 2 weeks after the second shot. And so, that should open things up, so especially for the kids. A few instances, however, where you would consider mitigation measures. For instance, if the child is immunocompromised in any way, if they're on, chemotherapy, or a cancer patient, advanced HIV, other medications that can suppress the immune system, such as steroids, the kids should consider, continuing the mitigation measures, masking, social distancing, avoiding poor ventilation. And same thing with the household. So if a child is in a household where one of the members is increased risk for a severe disease, if they're not vaccinated, other qualities that can cause them to have advanced disease or severe disease from COVID, I would consider keeping the mask on in that situation. And then lastly, what is the transmission rate locally? I think right now it's not so bad, but if the transmission rate gets higher, again, that's a situation where I would consider continuing the mitigation measures.
Thank you. Dr. Ganji, how might a highly vaccinated population of 5 to 11-year-olds change school mitigation protocols? And what might we be able to think about doing differently?
Sure. So I think that, there are basic things that should stick with us even after COVID goes away. The attention to hygiene, hand washing, et cetera, is just good practice in any setting like a school. But there are things in place that we've or put into place that I think will start to be eased. Certainly the physical distancing, I think, and measures that we have tried to keep people apart, whether eating or in other settings, I think is one of the measures that will begin to ease once a significant, if not all of the kids are vaccinated. I think that the measures that we have in place for quarantine, if we are concerned if someone is positive, we've been very cautious, and certainly CDC guidance is very cautious about quarantining people who may have exposure. I think with the tremendous efficacy that these vaccines have, those measures are not as warranted because the risk of acquiring COVID is so much lower. So you could have a student who may be have some contact with someone who's positive, right now they would be quarantined and out of school. This offers them an opportunity to actually continue in school. And then as, community levels improve and, the modeling and data that was shared at the ACIP committee suggests that vaccination will accelerate the decline in cases at the community level. That's where, the broader things that we've put into place, such as mask mandates and others, will begin to recede as well. So, there are both individual reasons for getting vaccinated, as well as community reasons for just helping, us to return to normality.
Thanks for that public health perspective. Dr. Minton, what are some tips for families regarding managing the upcoming cold and flu season?
Well, first, get the flu shot. That's number one. I think that it's going to be important that we continue to make sure kids don't show up at school sick. I think that we're going to really want that. And I think we're still going to need to be doing testing for both flu and COVID through this particular winter season to sort of know what we're talking about and protecting the kids in school from both of those illnesses. But I think it's going to be good hand washing and really making sure that we really try to keep sick kids away from school and away from groups, and try to keep people as healthy as possible.
Right. So it's good old-fashioned public health measures.
Yes.
Dr. Goldstein, if you could unmute, how should families go about getting the vaccine?
That's a great question, and it's hard. It's hard to know. So, like Mary Jo's practice has the vaccine already. Our practice does not. Ours is supposed to ship this weekend. They're not telling us how much we're getting yet. So I think that to the extent that they can find it anywhere is where they want to get it. If you can, CVS, Walgreens have opened their registry so you can sign up for the vaccine as of now. And we posted that at our practice for parents to find as soon as we get it. We intend to have outdoor vaccination clinics. We intend to have outdoor vaccination clinics where we're going to offer it to as many people as we can. And it's a matter of supply. Once the supply is there, we're going to do it. But that's the plan. Just, wherever you can get it in your local community, you get it as soon as you can.
Great. Friends is also looking into some options for offering a clinic.
Which is great, yeah.
I think they'll feel like there's a shortage for a couple weeks. I think people are very eager to get it. We do have some, but we have some for 100. We have 150 patient doses. So that's obviously not going to meet the needs of our practice. But I think it's going to be delivered weekly to new places. The health department is working hard to distribute it. I know they've gotten big doses today. I feel like within the next few weeks, people are going to have access to it. And I think it's going to get people vaccinated pretty close to being fully vaccinated by the holiday winter break, which is nice for families. So
that would be great. Any final thoughts from our panelists?
Lynn, just to add one, I think it may be important for parents who are interested in the underlying data to know that the presentations that were made by Pfizer and by to the ACIP are actually available online. So you can actually review the same information that was presented to the committee, and there may be, there's a lot of good information in there that parents may be interested in.
Fantastic. I'd like to urge our Friends School community to consider vaccination for your children. I highly recommend that. I'd like to just close by saying thank you to each of every one of you for your advice and your willingness to partner with us. We really couldn't have school in session without all of your expertise, so thank you. Stay well.